U.S. Senator Kirsten Gillibrand is pushing back this week against proposed budget cuts included in what President Trump and Republican leaders are calling the Big, Beautiful Bill. According to the nonpartisan Congressional Budget Office, the bill that's now before the Senate would reduce Medicaid spending by about $800 billion and add more work requirements for many families. About a third of the North Country's population is enrolled in Medicaid, the federally subsidized health care program. The president and many congressional Republicans want to cut Medicaid funding and limit who's eligible for the program. Senator Gillibrand paid a visit to Adirondack Medical Center to speak out against the cuts.
This big, beautiful bill is not a big, beautiful bill. It is a big, beautiful betrayal. And what it is doing is gutting rural health care. Here in the North Country, the numbers are very troubling. Over 2,600 jobs could be eliminated right here in this congressional district, while about 44,000 people would lose their health insurance and 19,000 people would lose access to their nutrition benefits under the SNAP program.
SNAP, the Supplemental Nutrition Assistance Program, helps more than 40 million Americans buy food. That program is facing a proposed cut of nearly $300 million in Trump's budget and added work requirements for families. North Country Republican Congresswoman Elise Stefanik has said that the changes to Medicaid would strengthen and secure the program by eliminating fraud and abuse and preventing ineligible people from enrolling.
There's no evidence to support her statements. We don't have a scourge of Medicaid fraud in this country. We have a lot of low-income families who can't afford health care.
The CEO of the Hudson Headwaters Health Network that receives federal funding to help families in lower income and medically underserved regions, like the Adirondacks, said that cutting Medicaid will force people to rethink their health care.
When you call the ambulance, you don't want to be thinking about the bill. When you see your provider for routine health care that prevents problems down the road, you do not want to think about the expense. Because when people do that, they tend to forego care.
The Senate is currently working on its version of the Trump budget, with a vote expected in the next week or two.